mental health, and coping strategies. While preparing this presentation, I was surprised to learn that there is positive stress called eustress. This type of stress is known to be beneficial to the body, and it plays a vital role in stimulating motivation and energy, although it's short term. Anyway, my name is Cheryl, and I'm going to be presenting a few points that I gathered through the research regarding psychological stress. So when under pressure from our morning routine, secular employment, suffering from any type of loss, can be financial, death, just to mention a few, the body goes through an emotional reaction known as psychological stress, and this a negative stress. So when under psychological stress, the brain releases two hormones known as the cortisol hormone and the noradrenaline, which affects negatively on the body's mood and the bodily function. So there's a variety of sources of psychological stress, and today we're just going to discuss only 6 major ones that I managed to gather. So the first one is day-to-day stress. This can be any activity in your routine that puts you under pressure, e.g. your normal job, maybe the stressful duties that you do at work that can put you under pressure, or unexpected negative stress, which can be overwhelming feelings triggered by life's unexpected events, for example, divorce. And also, like in the picture there, you see the child is going through trauma being caused by the parents that are arguing. So it's called stress-related trauma, being involved in a frightening situation, for example, a warfare. And there's also acute stress. It's a short-term feeling that occurs suddenly due to traumatic events. For example, you experience a tsunami, things like that. And the fifth one is chronic stress. This is like an ongoing feeling of stress that lasts for a long time. This can be caused by unemployment, or maybe you have some housing issues whereby you have to live in temporary shelter or accommodation whilst you wait for a permanent solution. And whilst you're going through all these things, you suffer what they call chronic stress. And then the last major one can be personal stress that affects individuals directly outside secular work or school. Like in the picture there, we can see the healthcare practitioner. They're going through, they're at work, but you can see that the way they are responding to what they're going through, it might be personal stress such as debt. Maybe they've got so many debts that they can't pay for, but still expected to perform at work. So these are the major stress, main sources of stress. So let's look at the effects of psychological stress. If you look at the picture there, there's burnout, depression, chronic fatigue, frustration, headaches, hormonal problems, failure, sadness, and all these things listed there. So it is imperative to understand that each individual is different. So psychological stress effects differs per person, and the secret is how you control or manage the condition. So as mentioned in the preceding slide, when the two hormones are released, the noradrenaline and cortisol, when they are released in excess, they cause both short-term and long-term causes. And the individual that is experiencing the psychological stress or these hormones in excess, they start experiencing the following physical severe health problems, such as depression, heart disease, digestive problems, headaches, insomnia, weight gain, and tension impairment can be brought on by prolonged stress. And bear in mind, this depends on individuals. So they also experience emotional health problems such as low self-esteem, isolation, substance abuse, nervousness, just to mention a few. So let's look at an effect that is also caused, but this one I've just specified it as an example of what we've just discussed. So this is called, it's a condition called post-traumatic stress disorder. This is an effect of having a psychological stress. So the condition is one of the effects caused by being exposed to extremely frightening, stressful events. For example, we've got a young British Army officer who was posted to Northern Ireland for peacekeeping when he was in his mid-20s. So when Craig was involved in warfare, he spent about 7 years involved in war. And during that time, he was going through a lot of frightening situations whereby people were being killed and his life was at risk. And the whole situation caused a lot of trauma, not only to him, but also to his colleagues. So in the end, when his assignment was completed, he was redeployed back home. And when he went home, that's when they could, the symptoms of his stress or the trauma that he'd been exposed to, they started presenting. So when he returned home, he was diagnosed with PTSD and by a professional. So he was now experiencing flashbacks of all the things that was happening during the war. And also he had insomnia, he couldn't sleep at night, and he was avoiding associating with people that were in his life. Pre-war experience, like his family and his friends, he could only associate with his wife. So these problems that he was facing were caused by the trauma that he went through during war. So let's look at the strategies that can be used to cope with stress or stress reduction. So coping is when an individual responds to unforeseen pressures that demand more work and energy than on a daily basis. So the first thing to do is to come up with a plan. That is the first strategy that most people apply. So you come up with a plan, you write it down as shown on the image. So you write it down, and it depends with the severity of the case. Some people will decide to open up to someone. This can be a friend or family or a colleague or whoever that you're comfortable with, that you can open up with. Or you can seek professional help if you feel that nobody's understanding you. So the individual affected might actually seek for professional help. Professional help, you're referring to seeking help from a counselor, psychologist, or a psychiatrist, whichever professional that you choose. And also, there's another strategy that most people use. Affected people, they use cognitive behavioral therapy. This is also shortened as CBT. This is a therapy whereby you will be, the individual will be helped to understand their situation, and get help to deal with the feelings of sadness that they feel or the traumatic experience that they've gone through, depending with different cases. And also, you can use the relaxation techniques to reduce stress. So this is another coping strategy. So relationship boundaries has to be set. And some people, they do very well with exercising, meditating. There's so many techniques that can be used, like as shown in the images, that these breathing techniques, visualization guided, that's part of the meditation. All these techniques are mind life skills that can be applied. So let's look at the assessment, the effectiveness of coping strategies. It is essential to investigate and test a number of strategies in order to ascertain which one works best. A strategy might not involve some trial, it might involve some trial and error, because each person is different. So individuals are different, they respond to stress techniques differently. So a coping strategy that focuses on the problem, that is when change of a troubled environment or relationship is introduced, and it's highly effective. Proactive control, emotional focus, medium control, and it's uncontrollable. Avoidance, this is a low effective temporary control. Physical activity involves high effectiveness and general control. So there are wide ranges of coping strategies that one can benefit from when suffering from psychological stress. The most important thing is to identify which mechanism works best for the individual and accepting that one needs help. Thank you.